Patients get very nervous when they hear that they're being advised to get chemotherapy, and I think it's important to ask the doctor why they're getting it, what's the reason, so that the doctor can explain why they're giving the drug, what the benefits are, and also go over what some of the side effects are. Chemotherapy now is done outpatient, so in a clinic setting. They may get their blood drawn ahead of time. Sometimes that's done the day before or a couple days before. After that, they'll often see a healthcare provider like the doctor or their nurse practitioner or physician assistant. And then they'll go for their chemotherapy, which is generally done in a chemotherapy infusion suite. And that generally involves having a cubicle or an area for them to sit in after getting some pre-medication to help prevent things like nausea. They can expect then a special chemotherapy nurse to come, and as most chemotherapies are done IV, they'll have an IV placed by that nurse and then get the drugs that they're being prescribed. And then once the treatment is done, the drugs are given, the IV comes out, and the patient can then go home. For the most part, the patient will not feel anything, and once the chemotherapy is done, the rest of the day they usually feel the same. I think it's important that the patient knows when they're coming in to expect a very long day or not, and I often tell patients if they are going to have a long day, they can bring any medications that they normally take in the middle of the day. They may be able to take them there, or we can give them their medication if they don't have it. It's often helpful, especially at the beginning. Patients are nervous, and it's good to have a support system with you. So if there is someone that can come with you, I think that helps a lot for the patient. It also helps them pass the time. Most infusion centers have like a television that they can watch, bring things like a book or something they want to work on, because a lot of it will be them sitting in a chair. How often you get the chemotherapy depends on the particular regimen you're getting. It's important to talk to your doctor about what the treatment plan is and what the goals of the treatment are.